Hello everybody. Today let's talk to Dr. Anil Kamath, Senior Consultant Surgical Oncology. Today he will talk about more about pancreatic cancer. Doctor, what is pancreatic and why it is required?
So, pancreas is an organ which belongs to the digestive system. It is located inside the abdomen behind the stomach. Pancreas has two main functions. One is the exocrine function, which is the production of digestive juices which are required for digestion of food. And other is the endocrine function or production of insulin, which is required to maintain the glucose levels in the body. It is a J-shaped organ. It has got a head, neck, body and tail. And cancer can happen in the pancreas like it can happen in any other organ of the body. It is not among the most common cancers, but definitely if we consider the deadliness, it comes very high.
Doctor, is pancreatic cancer is it tumorous or non-tumorous cancer?
Pancreas can have both benign and cancerous tumors. So when we use the term tumor, it means that there can be benign tumors which don't have the potential of spread. Pancreas is quite a common organ for benign tumors also. And there can be cancerous tumors which behave in a very aggressive manner and which can spread to other organs.
What are the treatments for pancreatic cancer?
Now, that will depend on the stage of the disease, the type of the tumor, and the location of the tumor. Pancreas, when the cancer comes, the next thing which we do is stage the disease. We may do a PET scan to see how much it has spread, and then we classify it as 1, 2, 3 and 4. Most of the early cases come for surgery. It's quite a major surgery, what we call as Whipple's operation, where we remove the head of the pancreas, the duodenum, part of the bile duct, and there is a complex reconstruction using the small intestine. But as the stage increases in borderline resectable or locally advanced, here by and large we have moved to chemotherapy first. We do not operate directly because this can land the patient in quite a few problems, or the results of surgery are going to be dismal. So what we do is select the patients by giving them chemotherapy. A certain number of patients shrink in size, and later on the surgery can be done in a much better situation. And lastly, we have the metastatic cases where the tumor has already spread. There is very little role for surgery here, and by and large treatment is by palliative chemotherapy.
Doctor, if someone has pancreatic cancer, transplant of a pancreas is an option?
By and large, transplant is not an accepted modality for treatment of pancreatic cancer. This is because, first of all, pancreatic transplant is not an easy surgery. To get a donor pancreas is quite difficult. And when we talk of this thing, even if you replace the pancreas, the patients can very well come up with the tumors in other regions like the liver and lungs, making the transplant futile. So no, transplant is not an accepted modality as of now for pancreatic cancer.
What is the survival rate of pancreatic cancer?
Unfortunately, pancreatic cancer counted among the most dismal outcomes. So even after proper surgery and this thing, not more than 20% patients were alive at the end of 5 years. But this has changed in the last few years, mainly due to the introduction of multimodality treatment. So by giving someone chemotherapy first, then operating, and then adding radiation is required, we have been able to improve this 20%, at least in some cases, to something like 40-50%. But still, if you compare other organs like breast and all, most of the cases are still problematic when it comes to pancreatic cancer.